This is Gynecologic Surgeons Unscrubbed, a series-based podcast focusing on surgical and medical education and featuring expert interviews and practice-changing discussion. Our host is Dr. Cara King, a member of the Cleveland Clinic's section of minimally invasive gynecologic surgery. Dr. King is also the director of benign gynecologic surgery and associate program director of the Cleveland Clinic's MIGS Fellowship. This podcast is a collaboration between MD Edge and the Society of Gynecologic Surgeons. We'll be right back after this message.
This podcast is made possible by Boston Scientific. To learn more about Boston Scientific, please visit bostonscientific.com. The opinions expressed in this podcast belong solely to the featured clinicians and do not necessarily reflect the views of Boston Scientific.
And now, Dr. Cara King.
I am joined by Dr. Tommaso Falcone, who is the previous chair of the Cleveland Clinic's ObGyn Department and Women's Health Institute, and is the current chief of staff in London. We've discussed how you developed your career. Now I'd like to switch gears.
Yes.
You are such a leader in our field, and so many people look up to you as a mentor and as a coach. Talk to me about what characteristics make up a good leader. Right. So for people who are striving to become a leader. Yeah, exactly.
So leadership is, people have written many articles on this, and there are different components to a leader, depending where you are in your career. Just like surgery, there's certain technical parts to leadership. You can teach someone and say, look, if you want to be a leader in ObGyn, but I just do research, forget it, okay? You have to understand the different components of what it takes to run a department, both the patient experience and the economics of it, and then to build an academic department, the educational components, what it takes to attract research. And at that time, when you're ready to be a leader, you're basically going to put your career on hold. Not on hold, but certainly it is not the focus of your next phase of your professional career. So the day that you become a leader, your most important aspect of your job is your group of people called the department. Obviously, always the patient is the most important.
Yeah.
But for purposes of your faculty, those are the ones. Develop a robust group, make sure that they don't burn out. And you can sum it up by that title of that book called Serving Leader.
Yeah.
So the serving leader is definitely something, but it's a learned behavior. So it cannot be a self-serving leader. It has to be a serving leader. And so that is one of the components. An offshoot of that is what people are euphemistically always calling emotional intelligence, which is sort of a catch term. So emotional intelligence is part of an introspective approach to what you are doing. And so there are some that will have it or not, but you can, again, mostly learned behavior. So in leadership, always have that component, of being the serving leader, understanding the complexity of it. When I was, a trainee, the chairman was always the guy, and it was usually a guy, was that
True statement.
that's right, that was the most successful in research.
Right.
It could be, it couldn't talk, couldn't interact, but amazing research. So that's gone. That's
True.
the total past.
Yeah.
So I think that the leader has to be someone who recognizes talent and fosters it. And that's why it's the serving leader. So my main role was to look for talent and bring it to the Cleveland Clinic or my own department, wherever I am. And that is what I'm doing in London. I'm looking for talent, and that has to be part of it. Ultimately, all these learned behaviors, and you can learn them. There's one, part that obviously is not going to be learned behavior, and it's a passion. A lot of people from my day would say, look, the natural trajectory of an academic person, I'm going to be a good clinician, I'm going to be head of a division or section, as we call them here, I'm going to be a chairman, by 45, and then I'm going to really do what I want when I'm, 59, which is dumb.
Right.
So the leader, the thing about being a chair is just not the usual anymore, like a natural trajectory. Because there has to be a passion. There are a multitude of passions. For me, it was always building a team, and another book called Team of Teams.
Yeah.
Right. So I was always building the leaders of those teams whatever they were for endometriosis, for urogynecology, education, research, and bringing together this team of teams so you have a group of people that you were very proud to have been the leader of the group. And it's always been that way, although the people that were chosen as leaders were really didn't succeed because of their particular interest was something else other than leading. So you have to devote a lot of time, build these teams and all that. But in the modern era, I think that the main component, or at least the sine qua non of leadership, is a passion for women's health, right? So you cannot just say, I want to lead an academic department, I want best residency program, best fellowships, best research lab, and you say, but women's health is relegated to politicians and ACOG or whatever, SGS. AGL,
right?
ASRM.
Name a society.
Yeah, like someone else.
Right.
I think that's the passé. So the passion for women's health has to be an intrinsic part of being a leader. So you have to live it yourself. And you just can't, say, okay, I voted for the correct president of the society. So that passion for women's health has to be translated into being involved in the community. Now, the community could be your local community, could be the community in leadership roles. But one of the things that's important, it just cannot be ticking a box off.
Right.
Like I was a president of SGS. I was, executive, and now I'm moving on to the next one. Like you're ticking all your boxes so that when you die, you say, I've ticked all the boxes.
Yeah, exactly.
So to be a leader then is a long-term commitment towards building these teams, having the emotional intelligence, not the intellectual intelligence, and at the same time a passion for women's health. But because if there's no passion, you'll have a really good department, but you'll never have an outstanding department. If you have passion for it, then you will build an outstanding department because there's a gain other than just, like I built, an amazing group of people.
Like personal gratification.
That's
it's
right.
more than that.
Yeah.
You have such a knack for creating such an amazing team that everyone lifts everybody else up, and it penetrates when you are part of a good team. It's palpable. You talk about finding people with specific talents to recruit to your team. Couple questions off that. So what talents are you looking for, and how do you identify those? Like, what kind of questions are you asking, or what kind of actions are you looking for to help recruit those people?
Well, the first thing is always a passion. They have a passion for something, whatever it is. So when you look for someone to lead a group, like a team, the first thing that I look for is always a passion. Say, oh yeah, I really want to build a team. Now, if they just want to build their careers, I'll still hire them, but not as a leader, because they, I will still hire them because they're very good, they're very smart, and they want to build, their career. There's nothing wrong with that.
Yeah.
But if you want to recruit a leader, that's to me a passion for building the team. So ultimately, the success of that person is the team. So if my success, for example, was someone looked at my H score, which is how many times your papers were quoted, as the only type of success, that's a major failure. Like nobody should care what I have personally done, 10 publications or 16 more surgeries. What they have to care about is what my team has done. So if my team is a failure, I as a leader am a failure. Now, you don't have to be a leader. You can just say, look, I'm here because I enjoy fulfilling my career objective, and that's fine.
Sure.
When I recruit people, you have to look immediately and say, are you a leader, or are you a person who's going to be part of the team, but amazing part of the team? And there's nothing wrong with that. But I will judge you if you're the leader by your team, but if you're here as an individual, then obviously I will judge you by what you've succeeded. Then I will look at your papers. I will look at how you've succeeded in building an endometriosis program or a fibroid program or anything of that nature. So when you recruit people, you have to look at them and where they are in their career. Like for example, for you, it's more about your own professional development. Where are you? Where are you going? And also to recognize that it takes a diversity, a broader sense, a diversity of thought. Like, you can't all be clones. Like everybody says, like they have to resemble me, intellectually, if not physically. And so then, and that's not good. So diversity of thought. But, at the same time, you don't want someone who's toxic to the group. So that'll destroy the group. But if we're all thinking the same, then there's no diversity. The diversity of thought is the success of a team. So, for example, like for us, we do not have non-competes.
Right.
Right? So if you wanted tomorrow to go right across the street and say, okay, I'm going to sit up right across the street, the Cleveland Clinic never thought that was a problem, because honestly, if you don't want to be here, why am I keeping you here?
Mm-mm.
And so therefore, you have to be a good fit, and you have to feel that you're a good fit for
Right.
us. So recruiting, then, I have to tell, when I recruit people, there are a few things I tell them. Where's your role? Do I see your role as a leader or as a member of the team? And both of them are very important. And then the other thing, when I recruit people, I always tell them, you need to trust me.
Mm-hmm.
Because, you can make all the promises you want,
Mm-hmm.
but ultimately you have to say, are you going to keep these promises? Or tell you that I can't promise this.
Mm-hmm.
So the critical part here is always, do you trust, the person? I have to trust you that you'll deliver, and you have to trust me that I'll deliver for you. Because it's a big move, like for you,
Right.
moving your family.
Right.
So you don't want to do that.
Mm-mm.
Same thing, like I remember we were recruiting for fetal surgeons. And at the time, I said to someone, I said, well, I'm not going to move you until I know I can give you the team that you need to do fetal intervention.
Right.
So this is what you do when you recruit. Are you a leader, or you are in the phase of personal professional development? And again, there's nothing wrong with that.
Mm-hmm.
And then, are you a good fit for you, and can you trust me?
Mm-hmm.
Because if you cannot trust the person to deliver, then you've taken a big risk in your career.
Absolutely.
Yeah.
Have you ever hired for a leader and then had them not deliver, or see that it wasn't a good fit? And how do you
Right.
go about handling that situation?
Yeah. So it's always much easier not to hire someone, because everyone will understand.
Right.
Like, I'm sorry, I don't know if you're a fit, than to get rid of someone who is not a fit.
Absolutely.
Is not a fit. So hiring, try your best, to make absolutely sure that person is a good fit for the group. Because again, getting rid of people, everyone is hurt. I mean, most people that I have had not have asked to leave were actually very nice people.
Of course.
I liked them.
Of
I'd
course.
go have a coffee with them anytime.
Yeah.
But they just simply were not a fit, either because they were lone wolves,
Right.
like in a team. They just simply did not have the secret ingredient to making the team work.
Yeah.
So they were individually very, very good. And you can do it sometimes if you're a radiologist, I suppose. But
Right.
for us, you cannot do it.
No.
And so therefore, in the modern era, where we work as teams, the only way that you feel comfortable at 5 o'clock going home to your family and leaving your patients is to your team. If your team won't take care of them the way you take care of them, then you're going to be up all night, and then your family life will suffer.
It's not
I think.
sustainable.
So therefore, you have to make sure that you choose someone with a good fit. But sometimes you're wrong, and sometimes there are other times when people have told me, well, this person's not a good fit, and I have taken a chance with them, because you have to understand, why does someone say that this other person's not a good fit? And then you find out, of course, that maybe they're going through a very traumatic time in their lives, in their personal lives, and that what their behavior is at this particular moment is not representative of their true self.
Right.
So you have to really understand. But hiring, I would say 70% of my job was hiring the
Yeah.
right people. 70%. And maybe the 25% was actually running the actual department, because I chose people that knew how to run it.
Right.
But 70% was really spending a lot of time hiring the right people. Because again, if you hire the wrong person, but not hiring someone, like you,
Right.
like if someone said to you, I don't think you're a good fit, you say, thank you very much, I have other opportunities.
Yeah.
So therefore, I would rather know before rather than moving my family here and then finding out that it's not a good fit.
Absolutely. For people who are not currently in that leadership role, who are more in that professional development role.
Yeah, personal professional
Yeah,
development.
personal professional development. What advice do you have at making that jump?
Right. There's nothing wrong with saying that I don't want that leadership job.
Yeah.
You can say, I just don't want it. I mean, I'm perfectly happy. You can be very well known, president of many societies.
Yeah.
We have it in our own group over here, people that very well. And they said, I don't want to be, chairman of a department. I just feel that I can contribute better in a different way. And there's absolutely nothing wrong with it. And I think that we have to remove from the tick box of, I am not successful unless I'm a chairman somewhere. Because that was the traditional approach. First of all, you have to want it, and not wanting it does not diminish you in any way possible. So then if you want it, you have to make sure you have the skills for it. And the skill for it has nothing to do with how great you are in the operating room,
Right.
how good you are at research or
Right.
education, but it has to do with, do you feel that you are willing to put your own personal career, it depends on the level, of course, like as an equal footing, and maybe at a time it'll be subservient to it, with so your own professional career development to be maybe equal footing, and then with time less than the responsibility towards the team. And so therefore you have to always say, is this best for the team, or is it just best for me?
Right.
Like I operate on Monday morning.
Right.
Is this only best for a team? My surgery day was Friday.
Falcone Fridays, I heard.
Falcone Fridays.
I heard
That's
you're
right.
really
That's right.
productive.
Falcone Friday. And it was best. It was fine for me, but it meant I had to come in and see my patient Saturday, which a lot of people don't want to do. So it's fine. You can rotate it. So you have to look at it. Are you ready for it? To make the commitment, because you have a team members that are looking up to you. So if you say, look, no, I'm not, I just want to do the call schedule. Rather, is that your definition of the team?
Right.
A leader of the team? No. So once you're ready, this is what you want. This is where you are.
Yeah.
And don't do it too early.
Right.
Like a lot of people, say,
Timing.
I was head of whatever at 29. Okay, well that's not a good thing.
Now what?
Yeah, because
Right.
You say you're supposed to have been taking the time to develop your own career. Now you're going to have to do it in parallel with the careers of others.
And something's going to give, right? You can't do it all.
Something's going to give. That's right.
Yeah.
Like the burnout rate is so high.
Right.
And then don't underestimate mentorship. And I always tell people that most people in the modern era need 3 mentors. Okay. Or in my day it was always one. Which with my professional career. I want you to take 6 papers and attend 6 meetings and you'll get there. So that was your professional development. You need now. There's someone who to be a mentor for you, and that was it. So you said, well, what about the fact that my personal life is falling apart or whatever, or how to not have it fall apart.
Right.
So you have one who's for professional development. Then there's another for your clinical development. So a mentor for clinical development. For clinical development means that this person will tell me how many papers and the whole thing, whatever I want to do professionally. But for clinical development, he's not or she's not the one I actually go to when I have a tough clinical problem. How do I deal with this? There's, I've never seen this before. It's really complicated. What do I do?
Right.
So that's a mentor for your clinical development.
Okay.
Right? Very different from professional development.
Yeah.
For professionally, what do I want to do next? And then there's the third mentor is for your own personal life development.
Yeah.
So very different. Professional development, I think I can help you. Clinical development, I also think I can help. Personal development, most likely I'm not the right person for you because we're different eras. So you need someone that will say, look, how did you do this? People go up to Barry all the time, and she wrote an editorial for me for JMAG.
Yes, I just read it.
Yeah, and and I asked her. I said, Barry, I never had to deal with the fact that I have 5 children.
Yeah.
I said, you have 3 little boys. How did you do this? I won't be able to tell someone get a wife. I mean, it could be.
Like one of those.
It could be.
Yes.
I mean, but I mean, it's really not the answer. I mean, even get a husband is not the answer.
No, build a tribe.
Yeah.
Yeah.
So I said, there's a personal development, and that person is going to be very different from from someone who's going to be your clinical person. So Barry obviously is a urogynecologist. She's not going to tell you as an endometriosis, how do I manage this particular person? So that's a separate person. And then your professional development to achieve those goals or what you want. Now, if you're lucky, you may get, one person who can do 2 of those.
Yeah.
But I think most people will probably wind up needing 3 because there are different people for what you want in your life. It's hard to get, but I think that most people need those 3. And because you can be very successful professionally and clinically in a disaster with your own
Right.
personal...
At the cost of everything at home.
Cost of everything at home, yeah.
Yeah.
And it takes someone, some people don't, obviously, and it doesn't necessarily even have to be a physician for that matter, but I think that the new era of leaders, like Barry would be, she probably gets those quite a bit.
Mm-hmm.
Yeah.
Do you see any pros or cons about finding mentors within your department versus reaching outside your department?
For leaders?
I'm sorry, for your mentors. So these
your
three
mentors.
mentors. Yeah,
no,
yeah.
in fact, I'm been very fortunate to be a mentor for many. At the obviously professional development.
Yeah.
More than and clinical development as well, a little bit, but certainly professional development. Right across the globe.
Mm-hmm.
People have asked me, so, I need a mentor, where am I going, how to achieve certain goals.
Mm-hmm.
So it doesn't have to be within your department. I mean, let's face it, it's the same problems everywhere, right?
Right, exactly.
So clinical development probably should be someone in your department so you can go there.
Easily accessible. Yeah. Okay, well, thank you so much, Dr. Falcone, for spending your in-between OR cases with
right.
me.
That's what, what that means? That
Tell
OR
me.
turnover is very long at the Cleveland Clinic.
I'm not going to lie.
Yeah.
I'm going to run a quick 5 miles and then we should be about ready, right?
That's right.
All right, thanks so much.
Okay,
I'll talk to you
thank
soon.
you. All right, take care.
Thanks so much.
We'll be right back after this message. In this portion of our podcast, we turn to advocacy and continue our conversation with Dr. Megan Evans, women's health advocate and assistant professor of ObGyn at Tufts University School of Medicine. In this episode, we'll be discussing what's happening legislatively when it comes to endometriosis, as well as the power of social media in reaching out to your legislators.
So I really want to focus on endometriosis today. Can you talk to us about what's happening legislatively with endometriosis currently?
Sure. So there's some legislation happening at the federal level. There's one bill that's making a lot of headway in New York. So most of what I've found with legislation around endometriosis is really on education. So both for women, especially young women, as well as their providers. So in New York, there's a bill sponsored by Senator Monica Martinez and Assemblymember Linda Rosenthal. And the bill has passed both chambers and is awaiting the governor's signature. So it's really in the finish line, just waiting for that final approval from the governor. And essentially, this bill requires the State Commissioner of Health and Education to create and provide material on endometriosis to school districts and clinicians throughout the state. And really, the goal is that young women who go to their providers or go to their school nurse, they're able to identify the first signs of endometriosis to try to avoid a delay in diagnosis. Unfortunately, I think you know this more than anyone, that young women are really unaware that painful periods are not normal, and especially periods that keep them out of school, that keep them away from social events, and it can be really isolating from their peers, and especially missing out on those events as a young woman. So this really helps to try to combat that through education.
That's awesome. As you know, the average time of diagnosis, right, is like 7 to 10 years from when people present with symptoms to when they're diagnosed. So this is brilliant to start for younger age kids. Do you know how young are they going? Do you know, like, what grade level?
That, I don't know if it specifies in the bill, but I think the goal is really to start in the schools. So certainly school-age children, but I imagine the goal is to really identify women who, when they first start their periods.
That's great. Very cool. So I know social media is a huge place where a lot of people get their education for certain pathophysiology and different diseases. Do you know of anything on a social media level of campaigns right now?
Yeah, so for this particular bill, the Endometriosis Foundation, they started a social media campaign around this issue with hashtag Let's Talk Period, which was really to raise awareness about endometriosis and build support for the bill, which I think people underestimate how powerful social media can be. I always think about if I were to send an email to my legislator, I send the email and they receive it, but no one else sees that email going through. But if I were to tweet at them and I get retweets, it actually is so much more powerful to get that message to your representative, especially when there's a lot of retweets and then there's a lot of pressure for them to at least acknowledge these issues that are happening. And, for us, especially for women's health. So I think a social media campaign is always a powerful way to advocate for issues that you care about.
Are you on Twitter?
Yeah.
What's your handle?
At Megan Evans, MD.
Perfect. Everyone follow at Megan Evans, MD. Lovely. Do you have a favorite social media platform to discuss these bills?
I personally think Twitter is very powerful. I'll give you an example. So one of my representatives who was defeated in the last election is no longer in office, but we had gone to his office and met with his staff about the maternal mortality bill that I had mentioned earlier. And they agreed to co-sponsor it, but they didn't sign on to the bill, because you can check on congress.gov who is a co-sponsor, and you can look by bill numbers there. And we followed up with them a month later. They still didn't co-sponsor. And followed up a month later, still didn't co-sponsor. And then I tweeted at him and talked about the importance of supporting Massachusetts women with this bill. And 2 days later, he co-sponsored.
Stop it.
And who knows if my tweet was the deciding factor, but I do go back to me sending those emails. The only people that see them are me and his staff, but putting it on a public platform and having other people kind of retweet that message, and it elevates your advocacy efforts. And that's why I think Twitter can be really powerful when it comes to those type of issues.
Yeah, it gives you momentum and it gets other people involved and your voice is louder. So I absolutely think that's a really good point, because a lot of those people are on Twitter too, right?
Exactly.
You see a lot of
They're
their handles
all on
there.
Twitter.
So.
Exactly.
Yeah, that's great. So how about the national level? Are there things happening on that level as well?
Yeah, so similar form, there's several bills. There's one bill that directly focuses on endometriosis, some other bills that has a broader scope but does have endometriosis included in them. So one bill is bipartisan and bicameral. So bipartisan, I think most people know what that means. It means that both parties support the bill, Republican and Democrat. Bicameral means that there is a version in the House and there's a version also in the Senate. So this bill recognizes the significance of endometriosis as an unmet chronic disease and also designates March as Endometriosis Awareness Month. So this was introduced by Senator Tammy Duckworth from Illinois and Congressman David Scott from Georgia. And it's always important to remember when you're talking about these bills, the Senate bills always have an S, the H bills always have an H in front of them. So when you're talking to your representative, just make sure you're talking about the right version. So this bill recognizes the importance of endometriosis as a health issue for women, and really, just like the New York bill, works for greater attention, public awareness, and education about this disease. And then I think one thing that's always important, especially at the federal level, is that this would provide funding to conduct additional research on endometriosis and possible clinical options. There are several other bills that mention endometriosis, but it's not explicitly about endometriosis. So one example is a House bill introduced by Congresswoman Carolyn Maloney. There is not a Senate version at this point. And this amends the Public Health Service Act to try to establish a program of research looking at the presence of synthetic fibers, chemical fragrances, and other chemicals in feminine hygiene products, which is certainly an interesting topic. But one of the points of this bill is looking to see if there's any correlation with exposure to these products, certain types of cancers, infertility, and endometriosis. So right now there's no co-sponsors, meaning that none of her colleagues in the House have co-sponsored the bill. She's the primary sponsor of the bill, so it's pretty early in its introduction. And this bill was referred to the Energy and Commerce Committee in the House, which is a common committee that healthcare bills go to. There are two other bills that, again, benefit patients diagnosed with endometriosis. One is a bill looking at ensuring access to contraception of patients when they go to the pharmacy, avoiding barriers to patients accessing contraception. We know that using birth control pills, hormonal contraception, is important for patients who have a history of endometriosis. This bill was this is a bicameral. It's a partisan bill, so there's no Republicans who have signed on to it. That in the Senate has been sent to the Help Committee and in the House to the Energy and Commerce Committee. And then the last bill is, I don't know how much traction it will get, but it's requiring insurance companies to cover infertility treatments.
Very interesting. And that's all for this episode of Gynecologic Surgeons Unscrubbed. Join us next episode for more expert insights and perspectives. From all of us at MD Edge and the Society of Gynecologic Surgeons, thanks for listening.